All right, Kelly.
Good morning. I am Kelly Houghteling, Deputy Town Administrator for the town of Wellington, Colorado, and President of the League of Women in Government. Welcome to the second She Leads Gov virtual forum presented by IPMA and the League of Women in Government and sponsored by Cigna. Today is International Women's Day, the perfect day to hold this inclusive and inspiring digital event, Resiliency 2.0, redefining resilient women in local government. We have filled the virtual forum with thought-provoking and motivational speakers. You will also have an opportunity to connect with other women and men at all stages of local government, take a break and clear your mind, relax, and learn new tools and approaches you need to overcome the overwhelm and empower your voice to manage stress, improve the blurred boundaries of home and office, and recharge. Whether you are a student entering the profession or a seasoned manager, we hope today that you will be inspired to strengthen your resiliency for personal and professional growth. A quick housekeeping item before we begin about our IT technology today. So to navigate the platform, the menu on the left provides you with links to the schedule, speaker information, and the break room where you can find the links to our first breakout. Throughout the day, we ask that you raise your hand for the Zoom link and speak your questions. You can also type them right in the chat there. So please join me in thanking our sponsor for this event, Cigna, who continues to be a strong supporter of women in government and IPMA. Representing Cigna, please welcome Kim Funderburk, National VP, Government and Education.
Thank you for that, Kelly. How is everyone doing today? International Women's Day. That is phenomenal. I am so pleased to be here. I'm Kim Funderburk, National Vice President of Government and Education Business at Cigna. And on behalf of Cigna, a global health service company, I'd like to welcome you to today's second annual She Leads Government Virtual Forum, Resilience 2.0, Defining Resilient Women in Local Government. I hope you, your loved ones, and friends are doing well, as it looks like COVID-19 is once again on the wane and our communities are starting to move forward. Cigna is a very proud sponsor of this gathering that celebrates the extraordinary women that are leading government. And in partnership with IPMA, as Kelly said, we've designed today to present an event that will inspire all local government professionals to strengthen their resiliency amidst the changing and challenging pandemic. Our panel, Overcoming Challenges Faced by Women During the Pandemic, will focus specifically on that. And as I said, I'm so excited to be here and just wanted to share a little bit about Cigna because it is so wonderful to work for a company that truly understands the value that women bring to the workplace. My own experience itself demonstrates that. A company of more than 70% women, that recognizes and develops female talent and provides leadership opportunities for women. And while, here at Cigna, we certainly have made tremendous progress in creating more opportunities for women to advance, we absolutely know that there's always more to do. Nearly half of our current directors and senior directors are women, and we're committed to reaching gender parity by increasing the representation of women at our director and senior director levels to 50% by 2024. And we're holding ourselves accountable for that. We've joined the United Nations Women's Empowerment Principles, and we continue to partner with organizations such as the Women Business Collaborative and the Paradigm for Parity. We've also committed to publishing a diversity scorecard annually to identify key areas of opportunities and to track our progress against them. So switching gears a little bit, we've witnessed really a particularly difficult moment in time for women in all industries, many of whom have been disproportionately affected by the COVID-19 pandemic. Our research shows that women have felt the repercussions of COVID-19 as a result of vocational and professional choices, caring for their families, and access to healthcare. We also know that women may face different challenges than their male counterparts. And to ensure women feel supported throughout their careers, Cigna has a number of programs and strategic initiatives in place that focus on developing, mentoring, and coaching and advancing women. These programs include our Transformational Leadership Program for Multicultural Women of Color, for emerging leaders at Cigna, as well as the Women's Sponsorship Program, which pairs mid-career employees with sponsors with access to digital learning events, coaching circles, and virtual check-ins. This program was developed to specifically help, achieve that gender parity that we will get to in 2024. And as a company whose mission is to improve the health, well-being, and peace of mind of those we serve, you know that we are strongly committed to whole person health, body and mind. So please get your annual checkup and be sure to speak with your doctor about how you feel emotionally as well as physically. Our bodies and our minds are connected, and how we feel emotionally can affect our physical health. So be sure to take care of your whole self. And so I very much appreciate you allowing me that. And I know you're here to hear from this fantastic panel of women, so we will get to it. Again, we've put together this fantastic discussion, overcoming challenges faced by women during the pandemic. The pandemic reveals significant challenges that impact women in the workforce. And although women are stepping up to meet demands, they're struggling. In addition to the day-to-day challenges of their personal lives, women in the public sector face unique career threats. Many local governments are downsizing budgets, maintaining traditional policies and benefits, and eliminating crucial advancement opportunities, causing women to step out. So how do we keep women in local government? And for that question, we're going to go right to our panel. So let's meet this esteemed panel of women leaders, and they'll help us to address that question. But first, we'll start with introductions. Anne-Marie, can you start us off, please?
Two years in, and I still mess up when it comes time to unmute. Again, good morning. I'm Anne-Marie Sharp. I'm Director of Risk Management for the City of Miami. I have been with the City of Miami since July of 2013. Seems like forever. However, I've been in the industry a very long time. Over 20 years. I'm happy to be a part of this panel. I don't know how I got picked for this because I feel like I'm among an awesome group of ladies this morning. Thank you all for having me.
Okay, thank you, Anne-Marie. Welcome, Jane.
Yes, good morning. And I also say that I don't know how I got here, but I am very honored to be a part of this panel. My name is Jane Cheeks, and I have been with the City of Houston for 22 years, and I now serve under Mayor Sylvester Turner as the Director of Human Resources. So very excited about this roundtable today and this forum. Looking forward to hearing what my colleagues also have to talk about. Being with the city for 22 years and working under a strong mayoral form of government has been very, very long and arduous. I want to say that Mayor Turner has been very intentional about hiring females, especially as directors. I am one of 11 directors that he hired under his term. And he also has a very heavy female council, which is about 10 council members out of 16. So really just looking forward to this, and thank you for the opportunity to be here.
Thank you for that. Kelly, we've met you briefly, but give us a little bit more.
Yes, thank you. I am the deputy of Wellington, Colorado, and the president of the League of Women in Government. And thank you, IPMA and Cigna, for the invitation to speak today. I've worked in local government for about 11 years, so it's not as tenured as our other panelists today. So looking forward to this conversation, though. Thank you so much.
Thank you. And Shawn.
Well, good morning, everyone. I am Shawn Stokes. I am currently the director for the Office of Human Resources Management in Prince George's County. all this women energy is like really getting me pumped up. I want to give a huge shout out to our county executive, who is also a woman, Miss Angela Also Brooks, the first county executive for Prince George's County. And I'll do one better. Our Chief Administrative Officer, Tara Jackson, is also a female, and we are a powerhouse in Prince George's County. I bring to you today close to 21 years of human resources experience. 14 years has been in the private sector, not all with HR, but 5 of those years were with HR, actually with Cigna. And with the public sector for about 17 years doing HR. I've done it for local governments. I've worked in schools. I challenge any HR director on the call today, if you want to have the hardest job, trust me, it's in schools. Well, that's not necessarily true until the pandemic hit, but we'll talk a little bit about that. So thank you, Cigna. Thank you, ICMA, for the invitation today. I'm looking forward to the conversation.
Outstanding. So you guys, we are in for a treat based on what I've heard just from the introduction. So you guys should be as pumped, and I love the energy. So let's get into it. Our first question. So for this one, I'd like to hear really from each of you on the panel, please, and maybe we'll just follow the order of introductions. So tell us about your experience as a professional during the pandemic. You know, think about it. Is there a specific challenge you faced? And if so, how did you overcome that challenge? So back to you, Anne-Marie.
Thanks again. How much time do I have to do this? So let me start there. As a professional during the pandemic, I'll tell you that you all may recall that in the early part of the pandemic, early March, our mayor was diagnosed, tested positive for COVID. And so let's just say it kind of started there for us, right? Because he was exposed to a visiting foreign representative, and with him was, of course, you can imagine, the police detail, fire chiefs, and other city executives. So at that time, we quickly realized we had to quarantine all these people. Now, I'm risk management. So one of the first things you learn in risk management is not having all your key people in one place at the same time, right? You can imagine if something happens, you lose all your key people. Well, here we were, the early part of the pandemic, and our executive team, our leadership team, were all had to be quarantined. So that kind of started it for us. Soon after, we opened EOC. Risk management was a part of the Emergency Operations Center, to the effect that our job got merged into emergency management. Risk management was charged with working closely with the director of the medical director for our paramedics. And so it just kind of started from there. It was I cannot find the words to describe it. In terms of challenges, the biggest challenge we faced during that time was how quickly things were changing, right? I described it in jest as trying to catch a fish with bare hands, because as soon as we thought we had a procedure that would work, or we knew what we were doing, things quickly changed, right? So it was everything from contact tracing and trying to keep our employees safe, testing employees, deciding, who the employees who are in the field, how do you keep them safe? Does this extend to employees' families? Do we offer testing, quarantine procedures for families? It was a host of challenges every day. How did we overcome them? Pretty much by keeping our ears to the ground, right? As soon as Johns Hopkins University came out with a contact tracing certificate program, my staff and I, got our certificate, we trained for that. And in the meantime, we were just staying close to CDC, vetting our procedures with the medical director and the emergency management staff, and, with the blessing for city manager and mayor. So it was just a host of trial and error. We would just try something, it worked, we kept doing it. And in so doing, and aligning ourselves with the CDC procedures, we were able to overcome those challenges and got employees back to work as soon as they were able to, and try to keep the cases down as much as possible. But it was quite a task.
It sounds like, and I know no one is envious of you for having been in that seat to have to do that. At the outset of the pandemic, your whole executive team exposed to COVID.
Correct.
And look, you're resilient and still here and standing. And from what I hear, the city of Houston is doing fantastically. So thank you for that. Thank you. Okay, let's hear from you, Jane.
Wow. I mean, no one was prepared. That's where I want to start. No one was prepared. But one thing that I can say about Houston is that we've been pretty resilient. If you know anything about us, we've had floods and hurricanes and all of these different major catastrophes that have happened here. But my mayor, under his last 6 years, really has led us through all of those activities. So when the pandemic hit, it was all hands on deck. And under his leadership, the one thing that came out of it was that, when you're in HR, no one really kind of wants to mess with you, fool with you. They don't really want to see you coming. It's not until they really want you. But what the pandemic proved was that HR was essential, because the pandemic opened up doors for human resources that really hadn't been opened up before. And I say that because at the end of the day, this was all about people getting back to work during a time in which we didn't really know how and why all of these things were happening. So the mayor immediately instructed us to start with changing some emergency policies and procedures, making sure that our 21,500 employees knew what to do during this pandemic, whether you needed to stay at home. We made sure that everyone understood exactly how to handle working with the health department. It was a team effort, and I would be remiss if I didn't say that. All of my colleagues, especially working really closely with our health department, we all huddled together to make sure that everything was very succinct. Emergency policies coming out, advising employees that some could go home and work from home. But as you know, being a governmental entity, everyone couldn't go home. So there are jobs that still had to be done for the residents of Houston, and we had to try to do those as safely as we possibly could to make sure that our employees did not get sick, and that our employees was not passing on anything to our residents. So getting all of these policies in place, getting everything out to employees to make sure that they understood was a lot, but I couldn't have done it without a phenomenal team. My human resources department is only about 290 some people, and regardless of what section you worked in, everybody was doing something. I believe that our most challenging was when the mayor decided to put in a policy, an executive order for testing. Now, it wasn't for going to get the vaccine. It was strictly for testing. And of course, everyone had their thoughts about that, but it was for the safety. It was for the safety of all of the employees and again, all of the residents of Houston. So I believe that probably for human resources was the most challenging thing we had to do. 21,000 plus employees, we're saying, hey, if you have your vaccine card, upload it to the portal so we'll know. And if you don't have your vaccine card, we need you to do testing twice on the 1st and the 15th. And that was a lot. But what I'm really proud today to say is that we have that executive order still in effect. And we have almost 85% of our employee population that have reported. And that is a testament to from top to bottom, what we did to make sure that our city stayed safe and our employees stayed safe. So resilience is something that, again, we're really used to, but this pandemic pushed us to the edge. So thank you.
Absolutely. It sounds like, I'm not envious of Houston, nor, certainly everything that Anne-Marie had to go through in Miami. But let's hear from you, Kelly. What was the experience like, your challenges?
Yes. So in March 2020, my town administrator was fired. So that means I had to step up in the middle of a pandemic and lead our organization through some very challenging times, like everyone has already mentioned. In April, at the end of April, I found out I was pregnant with my first child. And so I was pregnant in a pandemic while interim manager. It took, I'll be honest, it was a different level of coping to try to navigate. And then we were also facing some much needed turnover. So 20% of my organization, we had some individuals that needed to go. And I'll be honest, that took some courageous leadership. I needed to find the right people on the boat to help to steer us in the right direction. My motto through that entire year was steady hand on the rudder, just trying to keep the ship afloat, keep moving forward. We also had council turnover. So about 3 of our council members were new. It was a very contentious election at that time. And so communication was key, just over communicating. I started doing weekly emails. I quickly engaged the ICMA network with other senior advisors. I called other city managers. Some of you might be on the call today. I did not know what I was doing, so I quickly engaged that superpower lady network and just kept in really close contact with them. It was very hard for me personally and professionally that year, so I started journaling and crying a lot. I'll be honest, it was very difficult to try to navigate, just the health and well-being of myself, worrying about my child during that time. I found out she had a kidney disease in the middle of that. And while she was still in utero, so it was a bit overwhelming to try to get the budget out, learning some information, having appointments down at Children's Hospital, trying to see what that looked like. So it was stressful, but I will tell you, I think the real key was just engaging with a lot of my, classmates from grad school, the text chains that I'm on, and then just the overall network. And that's why I love local government so much, is I feel like you could call anybody. You could send anyone a direct chat right here on the line and someone will answer your call. There were some city managers I didn't necessarily know, but I said, hey, looks like you have a really great, weekly council thing. Can I talk to you about that? I'd like to get better at that skill. So it was kind of learning on the fly on top of the ever-changing pandemic. So it was tough. And I think that if anyone's on my organization is listening in today, what we always talk about is grit and just being really, really gritty and toughing it out. But also it was important for me to model that I needed to take time for myself. And I think that's why we're all here today is you have to take some time because you can't refill if your cup is already empty. So thank you for joining us all today and being willing to share your story, because these times aren't normal. This is really challenging for all of us. Thanks.
Absolutely. Thank you for that, Kelly. I was just reading some of the comments in the chat, like you're a super mom, you're their new heroine, but from all the panelists, they are just so appreciative of the authenticity and the raw honesty. So with that, Shawn, I'm going to turn it to you.
Man, this is tough. I mean, everyone has pretty much hit all the core topics. It's all about resilience. And what I try to just kind of define it as, an extraordinary challenges that we faced since March of 2020. The best way that I can describe it, I felt like an octopus, but like with double the amount of arms, catching things, plugging, fitting in, trying to just close the gap, because you're right. Human resources was at the front, Jane, of every decision that was made. And from a government perspective, I think the most that we ever dealt with, maybe a closure or a shutdown or anything that even significantly, mirrored COVID, was a weather event. Armageddon, a snow events like that. So that was it. So this was really our COOP plans in place to ensure the continuity of government, and then was essential defined the same as a weather event. So it became this new term of what essential employee look like. And, with that said, I will say we are a 7,000 employee government, and we had exactly 250 people that could do remote working. We weren't ready. We were not ready. And within 30 days, we had to stand up an organization with the technology, with the resources, so that we could deploy, alternative working, virtual working, hotel in a pretty quick time frame. And that was, I don't know if many of you faced that, but that was a huge challenge for us in Prince George's County. And we did it. It was really tough. So imagine, again, 250, 7,000. We didn't, we had to do training, not just for supervisors, but for employees. And I'm going to give you one better. We did not have a online learning management system. All of our training had been done in person. I joined Prince George's County in 2018. These are all the things that we were talking about. And I'll tell you, it's like COVID was a curse and a blessing, because the things that I've been talking about for the first year of being on the job, I was able to do in the next 60 days. Learning management systems stood up, digitization of records, all of our records and performance management process was a paper process. I was staying up at night because I was concerned that something was going to happen to the building with all the personnel records in there. We digitized over a billion pieces of paper, over 10,000 boxes of paper, put in a new archival system, because we'd just been keeping paper. So, from a technology standpoint, I feel like we are so many years ahead, and I have to blame some of that, unfortunately, on COVID. So there were some benefits that came out of it, but the true test for us was our health department really, really suffered, and just making sure that we were pulling resources from all agencies, from the community, to make sure that we were able to deploy whatever services they needed. And it was really difficult. Again, different place, different time. And, I don't know that we were exactly ready for it, but at the end of the day, I can tell you within 30 to 60 days, we reacted, and we reacted really fast. One of the things I wanted to make sure all of our employees had was employee wellness. Within a couple of weeks, we stood up what we call our Level Up wellness program, and we were able to promote cooking demos, and we did dance parties at noon on Fridays. I ensured that every employee received what we called a wellness box. You'll see them, they're back here actually behind me. There's a couple of them. And these wellness boxes we sent home to every employee. They had things like masks and hand sanitizer and those little key fob things that help open the door, press the buttons on the elevators. And they loved it. I don't know that I ever saw so many firefighters that loved the chapstick that we put in the wellness boxes. I mean, it was just the little things to make sure our employees knew that we were thinking about them and we cared about them. And to this day, I still get so many compliments now that we're kind of in the new normal or in the endemic state. Like, when are we going to get more of those wellness boxes, Shawn? So I feel like, we really went above and beyond to make sure our employees heard from us. And it's great that we send a lot of messages and a communication, and we really worked to, be courageous leaders and act with urgency and communicate with transparency. But I tell you, the best benefit for me was when our employees actually did receive those wellness boxes, and they knew that that was a personal touch. I think practicing self-care, Kelly, as you said, was also really critical during this time. And I try to model by example. I get up, I take a walk every morning. I try to, cook my own breakfast, and I try to meditate. I do all those things, and I really try to pay it forward and share, what I'm feeling or how I'm feeling with my team, and also incorporate that into a countywide wellness program. So those are the things that I will say that helped us, me specifically. And I do think many of the women within Prince George's County be resilient through this COVID experience and through the pandemic.
Thank you. Thank you for sharing that, Shawn. I mean, you ladies are quite impressive, from everything that Anne-Marie went through in the city of Miami at the outset of the pandemic to, did I hear you right? 1 billion pieces of paper were digitized.
1 billion. Yeah, it was 1 billion pieces of paper.
Boxes of paper. Oh my goodness.
We have pictures. I should have brought some pictures to share with you. I mean, it was pretty scary, and like I said, I joined in 2018, and I don't know that we knew I didn't know it was that bad, but like I said, we got through it, and it was really made a priority. So.
Well, that's great. And, what I heard little pieces from each of you, but during this time, you cared about yourself. You were worried, about the population and your employees and, all the constituents and the communities. But you also took a little bit of time in recognition that there had to be a component of self-care, which kind of leads me to our second question, which is all about burnout. So I know you face that, everybody on the call, we've all faced that, right? And probably some of us are facing that today. But Anne-Marie, I'm going to take it back to you for this question. What has burnout looked like for you and within your organization? And how are you addressing it?
So I'll start with one of my employees on our risk management team who recently retired. And I felt that I really do feel her retirement was as a result of, or burnout may have contributed to that, right? Because her job was handling the return to work for employees who are, and most of the employees who've been out of work the last 2 years were COVID related. And so her position was liaising with the doctor's office, getting the statement saying, oh, the employee could go back to work and with restrictions of some sort. And then contacting the department and say, hello, officer, so-and-so can come back to work. When can you have him come back in this capacity? And as I said, it was, Miami was, COVID central during the Delta and part of Omicron. And she went out on FMLA. And I mean, I really feel it affected her in that way. Kudos to my workers' comp manager, my safety safety officer, who are both females. They stood in there with, I'm talking, we were doing 12-hour shifts. No, my team, we had to be doing 16, 18-hour shifts, right? Because it's not just an officer or a firefighter who is off, it's impacting their family as well. And so we are getting calls from everyone. And so I feel I encourage my team, take some time for yourself, please. Take a few hours a day. Do not pick up the phone on a Sunday afternoon, and I would beg them. I, on the other hand, try to tell myself the same thing, right? I should add that early in the process, we pivoted when we closed our building and everyone went remote. We pivoted our wellness program to something online, right? So we were offering Zumba classes, yoga classes. Our entire wellness program, wellness demonstration classes were done online through Zoom with instructor-led sessions. So for me, I dedicated 1 hour, 45 minutes. I tried to take an hour break, wasn't always an hour, 45 minutes for these sessions each day, Monday to Friday. I started calling it my WD-40 because I only realized that I needed it when it became, when it became painful, literally painful, sitting in my chair for hours, or when I get up, it hurt. Or so I would say I need WD-40, and these workout sessions were my WD-40, right? So Mondays, Wednesdays, and Fridays, the class I took, the class I participated in was 12 to 12:45. And I would try to schedule meetings around that, right? Or work my calendar around those hours. And I can't even say honestly that I made an effort to do this, because I think my body made me do it because I needed that WD-40, right? And so that was what I think helped personally through, I think that kept me from burnout. But I really do feel somewhat sad for, and happy at the same time, because I think it's happy that she's going into retirement, but I'm just concerned that this may have catapulted her to retirement, because of the burnout.
Yeah, I love that, WD-40. WD-40. So you think about oiling your joints and things like that. So, I hear you when you're talking about the person that was so burned out that you felt she was forced to retire. And I know a lot of times individuals are dealing with that. I need to work, but I'm too burnt out. I need to be here for my home. So it is so important that we set these boundaries, right? In our, so in our personal life, in our work life, and making sure that they are well balanced. So, Anne Marie, I'm going to stick with you. So let's set aside your body telling you you need WD-40. How are you really setting those boundaries for your personal life and your well-being? And are you sticking with them? Are you sticking with them when you
I'm not very well. Not very well. But I stuck with it for quite a few months, I have to say. Again, not because I wanted to, but more because I needed to. And as I continued the Zumba classes, because I did Zumba Saturday, Sunday, I tried to commit to that. Because I was working Saturday, Sundays as well, right? So as I did Zumba Saturdays and Sundays, sometimes I also did boot camp, but I did boot camp Monday through Friday. As I continued, I realized that it was helping me psychologically, right? So for those few minutes, even though with the phone rang during a workout, I'm still checking the phone to see who it is. And first thing I do when I finish the session is to respond, or if I have to jump on a meeting at 1, I have to keep my camera off because I just finished working out, right? So not having the time to change back, so keep the camera off and continue the meeting. So I don't know that I can answer that very well relative to boundaries. I honestly tried, and I think I maintained it for a while. I think it gave me the mental recharge I needed to get through that other part of the day. I can't say the other half of the day, because I finished working out at 12:45. I went on until 9 or 10. So it wasn't half of the day, but it gave me, I think, that recharge mentally that I needed, right?
Absolutely. It can be hard, to set those boundaries. Sometimes personal creeps to work and work creeps to personal. Any of the other panelists have any insights? Might be surprising you with that. Anything that works on setting those boundaries? Let us know.
It's easier said than done. Okay.
Yes.
Because sometimes we really do try. I think we as women really are so used to being strong, right, wrong, or indifferent. We're so used to being strong that sometimes we do have to hit a brick wall to be able to say, hey, okay, you got to slow down. So I mean, I know here, this is my, really my plug and my thank you to Cigna, because our wellness program really, really had to step up. I mean, we did so much virtual stuff, and that stuff was also for us. We started an executive program because a lot of times you can get your employees to participate in wellness, but what happens is we don't. We just keep going and we keep going. So I think that, and then a lot of times people don't look at employee assistance, and I want to say that publicly for me. Again, Cigna helped us with our employee assistance program. It was a partnership with our EAP on site and Cigna to be able to work together. Because one thing about the pandemic is people needed to talk. They needed to be able to have an avenue by which to go to someone and to let them know, because that became a big worry, not only for myself, but for my team, because we just were going. I mean, I think all of us, we went for years. Just think about it, we just kept going and we're still going. But I think sometimes the EAP, even for me, you know, as an executive, as someone who, I mean, I report to the mayor, but sometimes you just gotta talk it out. You gotta make sure it's okay. And so I think that those are the type things that assisted, but we do have to stop. I think as women, we do just keep going. We keep going at home and we keep going at work. And sometimes we have to say, stop it. And we need to put something in there.
Absolutely. Thank you for that, Jane. So you're touching on, you know, a really broad subject, right? So women, you know, we feel responsible for everything. We got to make it right. We're taking care of others before we take care of ourselves. You know, maybe we aren't getting treated as soon as we need to because our child needs to be treated first, you know, different things like that. And so I just want to step back and broaden the lens a little bit. So we've talked about the pandemic, some challenges associated with the pandemic. Now we're talking about burnout that gets us opening our eyes a bit more broadly. So Kelly, I'll turn to you. What are some wider challenges, broader challenges, I would say, though, that you think women face in local government, in the local government profession specifically?
And how much time do we have to talk about all of our challenges? This is a topic I'm really passionate about. I mean, the challenges that face women in local government right now, pay gap, that is so very real. And I would encourage you all to take a look and do internal pay audits and external, hire a consultant, do that every 2 to 3 years. We have got to do that. And especially for women of color, we have to be looking at these things, everyone. So please, if you're a city manager right now, please text your HR person and say, are we doing internal pay audits? If not, let's take a look at that. Paid family leave. We have to do paid family leave. Think about the impact that we have as local government. We are one of the largest employers in the United States. So if we're going to say, the federal government's, you know, they haven't stepped up and done anything. Well, what are you doing about it? You have so much power. Our organization is going to be rolling out 6 weeks of paid leave for birth, adoption, or placement of a child this week. And you've got to be looking at those things. I've got a community that's south of me that's larger that have said, you know, we've got to do a study about the impacts of paid family leave. It's too late for that. We have got to support families. I'll be honest, I didn't know if I could have a family in this profession. I didn't see it modeled for me. And that breaks my heart to think I've waited, you know, kind of a little bit too long to start my family now. So we've got to have those avenues to keep diverse people in our field so we can reflect the communities that we're serving. Flexible schedules. I know that we're feeling like that we're out of the pandemic, but kids under 5 still don't have the vaccine. I'm still working on the CDC return to learn guidelines for my child every time daycare is closed or she gets exposed. You know, I'm 10 days and I can't return to work. So we've got to continue to be really flexible. I know the city of Denver is returning people to work. I think that's one way we can pay our employees, right? Is what's the best way that we can be flexible for our team? If that means, you know, hybrid, that they want to work from home or do walking meetings or whatever it looks like for your team members, it's going to be different for every single individual. and we've got to respect that and work within the confines. I know not every employee has the luxury of working from home. We've got people in public works, police department, fire department, but let's think about other benefits that we can do that will support your team, and just ask your team members, what does that look like for you? Childcare issues are so real. In my county alone, we've got a gap of 7,000 children that don't have quality childcare, and they're using, childcare systems that, they're not licensed daycares. That's really difficult. So what can we do? How can we partner with the county? How can we look at our neighboring organizations? We see ourselves such as an island, but why don't we start talking together collectively and actually talk about regionalism? And this is something I really want to talk about, where, there's women and men on this line today, but a lot of times women tear down other women the most. And so let's acknowledge that right now, is that we are our own worst enemy. So what are you doing about it? Instead of tearing people down, how are you going to build up your fellow female? There's a lot of catty gossip that happens in the workplace. And when you see that happening, let's shut that down and start building people up. And when the negative comments start to come out of your mouth, hold them back, and let's be positive and support one another, because we are our own worst enemy. Thanks.
Thank you, Kelly. The comments are on fire here, but we'll move on. Shawn, same question.
I'm sorry, I got so engrossed in what Kelly was saying. Repeat the question, because I want to make sure that I'm answering it correctly.
Just broadly, challenges faced by women in the profession.
Yeah, I mean, I think, one of the things that I was definitely going to mention is the burnout. We, as I talked to you earlier about being the octopus, I mean, I do feel like in a lot of ways, and maybe others can relate to me, when COVID hit, I just kind of, I'm an executor, I'm an extreme extrovert. So I just kind of jump in, and it's just nature, a natural tendency for me to jump in. So if the county executive says they need a communication written to all employees about the health department and, testing, I'm like, okay, I'll write it, and it just, it became this thing where I felt like I was in the forefront of being a health officer, Homeland Security, and possibly, HR director and some other things. So I think that the burnout is really real for us. And we just by nature are nurturers. We want to take care of everyone. Unfortunately, sometimes we are last to take care of ourselves. I think that we also are the motivators, and we're the inspirators. We're the ones that like, yes, you can do it. And that too can be very exhausting. When your team is tired and you have to get things done, I found myself in a place of being like a warrior and being a cheerleader, trying to, get everybody on board to like forge ahead, because we had so many things that were happening in the beginning, specifically with the fire department and with the police department, and they really needed us. So it's almost like I felt like I was like, when I talked to my my mentor, she was like, it's almost like you were abusing yourself, and then it just kind of trickled down and you started abusing your staff. Is that fair, Shawn? And when she said it that way to me, I said, yeah, I guess you're right. I did. And it made me take a step back and look at how tired everyone was, including myself. So the self-care became really important to me. So, I still work from home a couple of days a week. I think that's important. I think, and it's okay. I felt guilty about that for a very long time. I really did, because I was used to going into the office. So now, I still work from home. I have accountability partners. I have 3 women that I work out with. We don't always work out together, but we share heart rate monitors, we share workouts, and we hold each other accountable to make sure that we're doing something every day, whether it's meditation, whether it's a weight workout or walking, whatever it is. I think that those are important to, counterbalance the challenges that we have, especially when we're in leadership positions, high turnover. I know a number of, women who left, who'd been in the government, for 20 plus years, just because of the change and the transition. Things were happening so fast. People just couldn't keep up. They just wanted to do it the way that they wanted to do it. But there was this urgency that things just couldn't wait and we couldn't be in kind of the same cadence. So it became uncomfortable for folks. So, you've heard of it, the Great Resignation. We are in it, we continue to be in it, and we've got to figure out what that looks like. The gender, a pay gap. You are exactly spot on, Kelly. It's there, it exists. We need to do a better job of making sure if our policies say we're going to look at pay every 5 years, then darn it, we need to look at it every 5 years. We need to break it down by gender. We need to break it down by age. We need to make sure that it's, all inclusive and, to the extent you want to call it fair, but we definitely need to do it. It's kind of like when your budget gets cut, the first things to go are like training. And I feel like when you're in crisis mode, the last thing that you look at is pay. And it really should be the first thing that you look at. And then I would say more than ever, the number one thing that I feel was really critical for us was childcare and caregiving. When the pandemic hit and the schools were closed, I got to a point where I said, I don't even care about leave. Family first, we'll figure it out later. And we did. And, I don't know how the other counties handled it, but we actually implemented admin leave prior to the whole FCRA. We call it FCRA, FFCARA. Could never get the acronym right, but we implemented our own we called it health and safety leave for our employees that, offered a number of hours. So because I saw people suffering, I saw people, just kind of trying to figure it out. And I was like, I don't care. The kids can be in the background on Zoom. They actually enjoyed it. And, I enjoyed having them there. So, I think that that's a real thing. And not just in the pandemic. I do feel we need to figure that out as we move and what kind of supports, we're going to have for our parents and our caregivers outside of the flexible spending. I feel like there's a concentrated effort that we need to make to provide services to our caregivers.
I love that, Shawn. Health and safety leave.
Yeah.
I hope everyone took notes there from the chat. It seems like you did. And so at Prince George's County, you guys were implementing some real innovation. And as you take a look at your employee benefits program or just your employee program in general, are there other things that you would like to see from an adaptation or adoption rate, I guess I should say? Are there other programs that you want to see more prevalent? Any thoughts there?
Yeah, absolutely. Prince George's County is the fifth government that I've worked for. I've worked in Philadelphia, Baltimore City, Washington, D.C., Montgomery County, and now Prince George's County. And I've seen a lot of things. And one of the reasons I think that I was so attracted to this executive team is because of those experiences and bringing some of these programs to Prince George's County. Now, we have done a great job over the last, couple of years, our wellness program included. I want to see us do better to make sure that it has kind of a DE&I spin to it, to make sure that it's all inclusive. So for me, like while we have it like kind of global offering, I want to be able to drill down and speak to it in the way that Jane spoke to it for executives. Like we do these like kind of like, events, but I don't want it to be an event. I want it to be an ongoing thing that we do that's targeted towards our executives. I'd like to figure out like what we need to do to be more targeted for our bus drivers, for our firefighters, for, our shift workers, for our folks that correctional offices. So I think it's good. We have a great foundation, but I want to figure out how to make it more targeted. I want to be able to, implement a better mentoring and mentorship program. So myself being a mentor, as well as, recruiting other women in the government or not in the government to come in and mentor women, and also to have folks be receptive to mentoring. Because sometimes I feel like, our women shy away from that for various reasons. And we can unpack that. That to me is like a whole nother conversation. And then thinking about what the emerging leaders and kind of grow your own programming looks like in Prince George's County, thinking about employee retention programs. We talked about the Great Resignation. I think there's a lot that we can do in terms of loan forgiveness, housing, offering tuition reimbursement. So it's more of a total compensation package. And, these are things that, a lot of you, many of you may be doing, but those are things that we've kind of piecemealed, but I want to make sure that it's like this retention package, not just to recruit, new talent, but also to keep the talent that we have. Because it is hard. It's very competitive out there. And given what is going on right now, all of us are going to have to step up our game. All of us are going to have to spend some money. All of us are going to do what we need to do to make our businesses, our governments a lot more attractive. And then last but not least, but I would say just pay equity programs, just making sure that we have pay that is comparable locally, nationally, so that, we're not, when I look at the pay out of a list of 10 comparable jurisdictions, I don't want to be 8. I want to be in the top 3. So just making sure that we're always looking at that. And it's always at the forefront of the discussion with the county executive and the chief administrative officer.
Wow, some really great nuggets there, Shawn.
Thank you.
Yeah, so I'm going to touch on, or I guess focus in on one thing that you said, and it was around mentorship, right? So I love the idea of, a fully developed mentorship program, especially on International Women's Day, et cetera, for women specifically. And as I take a look at this esteemed panel, and what I want you to do, panel, is just look back at your career. You can even look at it today, and certainly there was a support system that you have. Maybe it looks the same as it did before, or maybe not. But as a manager, how do you really support women? Because I heard from Kelly, hey, for women, sometimes we can be our own worst enemies. What advice do you really have on how we should go about supporting women in the organization? So Jane, I'm going to turn to you first for that.
So show up. That's where I want to start. We have to show up. And a lot of times, because of our schedules, because of our families, because of all of that, we sometimes, and again, let me not say we, I sometimes forget we need to show up. There are things like this forum. There are other things that come up that often we as women are invited to, that sometimes we just become too busy to be there. And women need to hear from other women. They need to hear the experience, and then they need to see we went through it, but we survived and we're still here. And that's really what's most important. I think that a lot of times too, that we forget, we have a very, very strong grow your own workforce here in the city of Houston. And a lot of times we forget it starts when they're little girls and they're looking up to us and saying, hey, how did you get here? Being a part of schools and what my mayor would say, underserved communities, being able to be there so that we can be that role model. And I know a lot of people shy away from mentors, and when you're a role model, you think you have to be perfect. You really don't. I think you learn from your mistakes, and people that see you make those mistakes realize that you've learned from them. But I think overall, we really do have to sit and we have to stop and think about where we're needed, not only in government, but where we're needed in our communities, and what we can do to be able to assist. I moved to Houston over 30 years ago, and I really wanted to work for the city of Houston. Now, that's not what worked out for me. I got here about 10 years later, but we also have to listen to what our real calling is. And a lot of times we want to do things as women. This is what the goal we've set. And a lot of times we're being called in a different direction. And I believe sometimes we have to listen to that calling. So I believe that if we just show up and we start gearing ourselves to more things where we participate with other women, where we are showing that we can be successful in these executive levels, and where we show, regardless, we make sure. I'm fortunate. Let me say it like this: I'm fortunate that I work for a mayor who was intentional about looking at women for executive level positions. But we have to be able to show other men, other executives, that, hey, we can do the job, and sometimes better, that we can do that. But we have to continue to show up for each other. And I think that is what's so important for us as women to be able to do.
Absolutely, to show up. That's it. 2 words: show up. And then as you think back then, Jane, are there particular barriers that you came across outside of just showing up? Are there other barriers we should be aware of? And how should we go about removing those barriers? And I'm saying specifically for women who are, trying to advance, within local government.
Well, we talk about, I think it might have been Shawn or Kelly that talked about communication. Mm-hmm. So the first thing is that I'm probably, you may not be able to tell, I'm introverted, but you still have to be able to communicate and to talk, and communication will help you remove those barriers. One thing that we do here is that the IT director is a female. Our payroll, administration and regulatory affairs is a female. We also have our finance director that's a female. That's all 4 of us are female. So we have sometimes a bi-weekly, but definitely a monthly meeting. And you have to be able to understand where you fit. If you're just, you got to break down those walls to know, like I said, HR, we blew the glass ceiling when it came to the pandemic. Everybody needed some form of HR, but on a daily basis, you have to join with your colleagues, whether it's internal in government or even external, where you get to talk to people in the private sector also. But I always say, start at home and have those meetings so you know exactly what's your seat at the table, because let me tell you, sometimes they don't ask you. So if you don't create the meeting, if you don't bring everybody together, if you don't talk about your input and what you can do and what we can do together, those are the type barriers you have to break down. You have to be able to communicate and have people actually see, hey, we're doing this over here. This is what you all are. And look, if we work together, this can be unbelievable. So my biggest advice to not only individuals that are in HR, but just want to be in government. If you have a passion to serve, if you have a passion to want to do something to help the residents of whatever county or city you work in, just be patient, because there is a patient component to it. Be patient, but come in and don't stop trying, because when you stop trying, that's when we lose. Just come in, keep going, be tenacious. They say we're a little tenacious. Be tenacious, but be respectful, but show what you can do for your organization. I tell everybody, government, I've been here 22 years. Government is the best thing, that service that we provide to individuals is the best thing that we could do. Now you see many more women than we've ever seen, and Houston is the 4th largest city and the most diverse. And at the end of the day, we all have all these different communities that want to see us grow. So, just communicate more, not because when you're talking, somebody's listening. I just, I could go on and on. Like I said, none of us have had enough time, but I'm gonna be quiet there.
Right. Again, just appreciate the honesty, and for everyone that's listening, what you should see is the diversity really of this panel, not just in color, but backgrounds, length of service, experience. Some have been in one place for 22 years. Some are, have been in different, maybe even different industries. And to your point, Jane, just to be tenacious. And so I heard you say you were an introvert, would not have guessed that. Yeah, diversity from being an introvert to Shawn, I heard you say you're an executor and an extreme extrovert. So for all of you, leaders come from every facet of life. So you guys can absolutely do it. And one thing that I don't want to end this panel discussion without speaking to are the working mothers. And Kelly, you were so passionate about it. And I can't, again, I just can't imagine new mom, contending with health issues of, your infant, also a new role. So I'd like to, just share your insights on working mothers. What advice would you give to them?
Well, I'm a new mom, so, I don't want to speak for all mothers, but certainly, I mean, gosh, the uncertainty of these last 2 years it's really hard and it's really isolating. And I think we need to talk about that more. And what I'm trying to do too is, talking about mentoring, there's, team members that I know want to have children, and I'm peeling back the layers of the onion about what it's like, about pumping at the office. That's been a mess where we've been under construction with this building, and I've had to pump in copy rooms and all sorts of different things. I know that there's a law that associates with that, but we just haven't had the space. So it's been really difficult, I'd say, and I think it's key is, again, we talked about being flexible, and what's most important is being an empathetic leader, having an empathetic workplace, and just working based on anyone's needs, mothers, fathers, whoever it is. Parents do, and even if you're caregiving for older parents that you might have in your life, that's also really important to recognize too. And I don't want to lose that point. And there's tons of research, that we've seen about what's happened to working parents and mothers in particular. We lost almost 1 million women in September 2020 to the pandemic and the variety of needs. And I know this conversation is mainly trying to talk about resiliency. So I have a quick top 5 of the ways that I have gotten through, the pregnancy and the pandemic, and then postpartum depression. That was very real for me and very hard to come back from, and impossible to try to get my brain back and re-engaged in that mode. And so here are my top 5 things of how I got through the last 2 years. The first, for mothers, fathers, whoever you are, is practice stillness. We're all very, very busy people, and rest is an activity, and see it that way. Give yourself the love you need, and that will look different for everyone. And I know in Michelle Obama's book, she talked about how Barack would go and work out, and she would be with the girls, and she didn't ever find that time for herself. So whatever that time for yourself, whatever that looks like, practice that. Reflect on what you're grateful for every night. I've got this daily gratitude journal. So I reflect on that, and then tell people what you're grateful for. I think so often we try to hold those things close to our chest of the gratitude, but share that openly with people. The WD-40, as Anne Marie said, is move your body once a day. You don't have to do a marathon tomorrow, but what can you do? Even if it's a 5-minute yoga, 10-minute walk, start somewhere. And then this is the most important thing that we can all do on today's call, is keep close contacts with friends and your power crew, your connections. Studies have shown that the biggest factor contributing to living a long life is the number of close connections you have. So continue to have the milkshakes, whatever you like to do, but the most important thing to live a long, happy life is having close contacts and communicating with those people often.
That's awesome. Thank you for that, Kelly. And so I know we're running short of time, so I'm going to wrap it up with a final question. And again, just going back out broad. And I'd like for, let's see, Shawn and Jane to take this one. So just any basic nuggets of advice for women. Who will start? Shawn, is that you?
Yes, I'll start very quickly and a little bit play off of what Jane was saying earlier. I think that it's really important as women for us to kind of for us to share our story. We're all on the panel here. We've got here different ways, and some things were like predictable, like we thought were going to happen, and in a lot of ways they weren't. And I think that people see the success a lot of times of the job that you're in or the work that you've accomplished. And I do think that there's a level of vulnerability that we've got to be willing to have as women to kind of share our stories and share our journey, and share how we got to where we are, and and what we aspire to be. I know that I don't feel like this is it. Like, I don't feel like this is the last place I'm going to be. And I continue to dream, and I continue to want to learn. And I, see myself in a different place in 5 years and 10 years. So, I just encourage all women to know your story, share your story. Don't be in the way of yourself. Don't be fearful. And just go for it. So those would be my words of wisdom and advice. It's worked for me, and I want to pay it forward in a way that I hope that it will work for you.
Thank you, Shawn. Jane?
I mean, wow, Shawn, you didn't leave much for me. You didn't leave much for me. I read a lot of different motivational things, and I am what some people would say. I love Steve Jobs. I love Apple, but I just love Steve Jobs, and a lot of times he always talks about work and loving what you do, and I think that that's a very important component that we as women have to actually look at, that you have to love what you do, no matter what that is. Love what you do. A lot of times I know you have to work because you have to, provide for yourself and your families. But I speak to our new employee orientation every 2 weeks. And I say the same thing. Every time I'm given the opportunity to talk to new employees, I want to say, you're here, you apply for this job, and you wanted to be here. So love it and make the most out of the opportunity that you've been given for what I feel is going to be a phenomenal career. So what I say to women is that you have to look at what is within you and what you really want to do for your career, and go for it. And if you should happen to be steered another way, stop. I like that, what Shawn said, stop and think about why. Maybe someone sees something in you that you don't see. And I say that because, and it's not enough time for me to tell my story, but I believe totally that I'm here because HR was a calling. It wasn't where I was going, but someone, and it was a female vice president that I got on the elevator with, saw something in me a long time ago. I won't age myself, but a long time ago. And she helped me to see the potential that and where I could go. And so a lot of times people don't realize or women don't realize that a conversation on an elevator or standing in a coffee line, you never know who you're talking to. You never know what it is that they're going to take from it. But it's really, really important, especially for us as women, to look at those different things. So I know that that's a lot. That's kind of what I've lived. And just make sure that make yourself happy, because as I tell my team, there's really not a day that I have that's bad. I have bad moments within my day, but I don't have bad days. So have a great day and enjoy what you do. And like I said, be there no matter what profession that you're in, and show up to make sure that you're a part of the solution going forward. I just appreciate being here. Thank you very much, Kimberly.
Thank you. Thank you. I mean, ladies, this was absolutely phenomenal. And I just want to thank you so much for your participation, for sharing your insights and advice. What I saw from the chat, real, raw, authentic advice. And I know that there's so many things that I took away from the discussion that I'll remember. And I certainly hope for those of you who are out there listening that you were able to glean a few key takeaways yourselves. I think you did from what I saw, the activity in the chat. And hopefully these insights will help to not only keep, but help to continue to elevate women within this profession. So as discussed during the panel, from each of the panelists, taking time for your personal well-being is especially important. So for our first breakout, or our first break, excuse me, it includes a mindfulness and meditation podcast on managing stress. So we encourage each of you to take a few minutes to listen to the podcast, which can be accessed by going to the break room tab. But thank you, panelists. Excellent job. Thank you.